This is Coach PDHPE with another Year 12 PDHPE video. For more Year 12 PDHPE information, you can find it at www.coachpdhpe.com. Today we're going to be looking at Core 1, Key Idea 4, what actions are needed to address Australia's health priorities. And this is probably the most infamous dot point in the syllabus. It's all about the Ottawa Charter, and I think a lot of people would agree that's probably the most challenging dot point in the syllabus, if for no other reason than the sheer content of information that students are required to learn. And for that reason, I'm going to split this video up into two different sections. The first point down the bottom there, the Ottawa Charter in action, I'm going to cover that in a subsequent video. But for today's purpose, I'm just going to get into those first three dash points. So just back to the key idea for a moment. What actions are needed to address Australia's health priorities? I think that can be written a little bit better, as the example is in green there. So how can health promotion, that being the Ottawa Charter, be used to address mental health and cancer in Australia? Because they're going to be the two health initiatives that I'm going to look at in many of my examples, and also in the subsequent video, the Ottawa Charter in action. So governments are seeing the value in putting more money into prevention over cure, and health promotion is one means of doing that. And governments will use the Ottawa Charter as a guideline when formulating a plan for health promotion. Now, the starting point for all students, I think, when learning about the Ottawa Charter is obviously learning the 5 action areas. Now, I'm not going to spend any time on doing that, except to probably give some advice there, come up with an acronym. I go with DB Scratch. Some Year 12 students 2014 from my class certainly have some interesting examples, which I won't name here. But yeah, whatever means you choose to learn them, go for it, because it's probably going to get you at least one, or if not a couple of marks in the HSC examination. So the first dash point, levels of responsibility for health promotion. Before we get into it, what is health promotion? Well, it's not just one method. There's a variety of methods that go into place for health promotion to be successful, whether that's taxes on tobacco, or in the examples we're going to be talking about on tobacco. There's education, so PDHPE programs in schools talking about the dangers of tobacco, or community involvement. That's where local community groups could come together, for example, to talk about the dangers of mental health. So levels of responsibility for health promotion. There's just not one group that's responsible for it. It's about a variety of different groups working together, and it's got a fancy term called intersectoral collaboration. So groups such as individuals, media and schools, non-government organisations and governments all working together equals effective health promotion. So let's have a look at some of those groups. This is how New South Wales government talks about intersectoral collaboration, with the quote, make prevention everybody's business. So that's saying the government's just not solely responsible for it, it's all groups coming together. So let's have a look at some of the different levels of government here. Federal government, they often provide leadership to coordinate programs. They give information to the public on how best to stay healthy. And also there's federally sponsored health campaigns, such as some of the Drink Wise campaigns that we have seen. State government also run their own individual tailorised programs. In each individual state, they are responsible for road safety, and people living in New South Wales will certainly be familiar with some of those messages about staying safe on the roads. Local government, some examples there. They could provide areas that certainly encourage physical activity, and some of the beaches in Sydney have some park areas with exercise equipment dotted along the esplanades to try and help encourage people to stay physically active. Individuals are often asked to get on board because, let's face it, individuals need to take responsibility for their own health. They can't rely on other people to make them healthy. And they also can provide support to other family members and friends, particularly those people who are suffering from mental health problems. The media also has a responsibility in terms of providing meaningful information on risk to health. They also should be reinforcing messages about healthy behaviour, but I think it's often the case the media doesn't always do this. And particularly in many of the TV shows and movies, they're actually promoting contradictory messages about staying health, which is often an issue. You've got doctors, local GPs also involved with their interaction with their patients. So you might have a health a mental health initiative. It's important for the doctors to be talking with their patients about mental health. Non-government organisations such as the Cancer Australia are very effective in fighting lung cancer. So the next dash point, the benefits of partnership. So what's the benefits of all these groups coming together? We had a look at that term intersectoral collaboration, and you've got to link this into this particular dash point. So the actual definition of it is groups in partnership to achieve a common goal. And if you have a look at all those groups, we had a look at it in the previous dash point. When they all work together on a common goal, it's actually far more effective. Now, a number of years ago, the New South Wales state government wanted to improve health in New South Wales, and one of the means they did that was by sending a survey out to all New South Wales residents where they were allowed to respond on what they thought were the priority areas in New South Wales health. So that actually gave the individuals a bit of a say into the input of health in New South Wales into the future. Now that has many benefits. One of the classic comments is that when you have a say, it means you have buy-in. That means you feel part of the process and more likely to get involved in terms of staying healthy. When you get groups coming in together, it's just a combination of resources, and it's also more cost effective. So the third dash point, how health promotion based on the Ottawa Charter promotes social justice. Now there is three areas. You see lots of different definitions of social justice, but what I go with is three: equity, diversity, and supportive environments. And this is where this dash point becomes rather tricky, because it says you need to talk about health promotion based on the 5 action areas for each of those 3 principles of social justice. So in theory, there's knowing 15 different pieces of information. So I'm quickly going to go through those. For the social justice principle of equity, that's all about developing personal skills. And one way that happens is all children attending school in New South Wales get the same syllabus taught to them. So that's an example of equity. Creating supportive environments, equity example. In most jobs, there's at least a minimum level of safety equipment provided in some industries, and cost shouldn't be a factor in whether people should be using that safety equipment. So in many instances, employers are forced to provide, say, minimum standards of safety equipment. Strengthening community action. Groups that promote health issues for minority groups. So, for example, the Senior Citizens Support Group, they're all about lobbying government in terms of getting better equity for seniors' health. Reorienting health services. Well, an example for this is allocating more resources for HSC Health, which is a group that suffers severe inequities in health. Building healthy public policy, the pharmaceutical benefits scheme for the many low-income earners who would struggle to afford life-saving medication if it wasn't for the pharmaceutical benefits scheme. Diversity. Australia is a very diverse country with many different groups. Developing personal skills. Government programs to assist individuals to learn English. Therefore, they would better be able to access health information. Creating supportive environments, just signs in hospitals written in different languages to help all groups be able to understand what the directions in hospitals, for example. Strengthening community action, websites such as ruralhealth.org.au, that gives information to the rural community about what are the latest developments in rural health. Reorienting health services, interpreter services in hospitals. This is very important for people who aren't very strong in their English. At any time, doctors or nurses can ring this interpreter service where health information can be conveyed between the doctor and the actual patient. Building healthy public policy, AB Study, which is a government program in terms of getting assistance to HSC people to complete further education, whether that's extra placements in university or just some financial incentives for HSC people to attend university. The last principle of social justice, supportive environments. Example of developing personal skills, media campaigns about breast and testicular cancer self-diagnosis, so people giving the skills to be able to do some initial self-diagnosis, and if they've got any concerns, then they can go and talk to their GP about that. Creating supportive environments, making condoms readily available in public places helps certainly in reducing sexually transmitted infection rates. Strengthening community action, It's about groups coming together to lobby councils to install lighting at public exercise facilities so people feel safer, and then they'd be more likely to get physical activity happening. Reorienting health services, smoking quit lines is a great example. If people are wanting to give up smoking, certainly having a facility like being able to ring in and get some advice is extremely helpful. And finally, building healthy public policy. Young driver education programs as part of the education programs in schools is a way of supporting young people to get the skills to be able to stay safe on the roads. So the final dash point is the Ottawa Charter in action. As I said before, I'll cover that in a subsequent video, which you'll be able to find on YouTube or at the link on www.coachpdhpe.com. Thanks for listening.